Today I'm going to be mixing the toothpaste material. The supplies you're going to need are your PPE, your glasses, your mask, your gloves, and a lab coat. And then you're going to need your toothpaste polyether material. So this is the base, this is the catalyst. And when you dispense them, you want to make sure that you dispense in even length, even though the tubes are different sizes. You need your non-absorbing mixing sheet. You need your mixing spatula, your impression tray, your timer, and your 2x2s with some alcohol. To begin, you want to massage your tubes so that you mix all the material. You want to make sure you do that to both, not just one. And then you want to dispense them in even lengths. So I'm going to dispense my base. And then I'm going to wipe and recap immediately. And then I'm going to take my catalyst. I already massaged that, so that's good. And then we're going to, dispense that. You're going to wipe and recap immediately. And then you're going to scoop up your catalyst. And then you want to scoop up your base. And then I'm going to set my timer for 2 to 3 minutes. All right. And then you want to use a side motion for mixing. You might have to use the whole 2 to 3 minutes for mixing because it is a little thicker. Halfway through, you want to scrape off your spatula and then scoop it all back up. And then finish mixing. Once it's mixed, you want to gather all of it into a pile. It's very crumbly. And then you're going to take your syringe and you're going to pull out the plunger. What you would do then is you would scoop up some of the material. You'd put the plunger in so that and then you'd hand it to the doctor. And then once the doctor is doing that, the remaining material would be scooped up and put into your impression tray, just like that, and then handed to the doctor. And then the doctor will pop it off and examine it, and then you will run it underwater to get off all the debris. And then, oh man, I forgot a bag. After your material is in the patient's mouth, the setting time is about 5 to 6 minutes. The doctor will then pop it off. He'll examine, make sure you have every tooth, the tooth before and the tooth after, the prep tooth, and the detail and accuracy. And then what you're going to do is you're going to rinse it underwater right away. You're going to take it back and it'll be ready for disinfection. Remember, the setting time for this material is 5 to 6 minutes. So then I'm going to take a bag and label it with the patient name. And then I'm going to place the impression tray inside. Once the impression tray is inside, I'm going to take my disinfectant and spray every area of that tray. And then you're going to seal it up. Let it sit according to the manufacturer's instructions. Once it's set for the manufacturer's instructions, you want to open up the bag, take it out, rinse it under the water again. You might want to dry it off a little bit too. And then you're ready to pour up your impression. Usually the impression is mixed with stone, and you just pour it into here. For cleanup, you can dispose of your wax sheet. You want to then, the material on your spatula will get rubbery, so it'll just peel up, and then you can just cavity wipe that right away. And then cavity wipe anything you use, so anything you touch. So your tubes, your timer, your spatula, and I'd cavity wipe my syringe, my marker, my disinfectant spray, and my workstation. When your impression comes out of the mouth, this was what an acceptable impression would look like. It has the prep tooth, the tooth before, and the tooth behind. And then the detail and accuracy of the tooth is there.